Hi, today we're going to talk about sleepwalking. Did you know that Lady Macbeth sleptwalked? Well, this video will explain why William Shakespeare got it right and Hollywood got it wrong. Hi, welcome back to Sleep Talk with Dr. Dev. My name is Dr. Dev. This is my sleep assistant, Barney. How's it going, Barney?
All right, Dr. Dev.
Now, sleepwalking is a very, very common condition. And guess what? It might occur in 1 in 5 children and teenagers, and still many adults might still do it about 1 in 20. Now, sleepwalking describes that odd behaviour at night time when they walk around whilst asleep. They are actually asleep and not awake. It's also called a non REM parasomnia, or abnormal behaviour in sleep. Now, there's 2 phases of sleep. One is REM sleep, or rapid eye movement sleep, and this is the time when we dream. And then there's non-dream sleep, or non-REM sleep. And this is the part of sleep when people sleepwalk. They tend to sleepwalk in a phase of non-REM sleep called slow wave sleep. And this is where the brain waves, or the EEG, looks like this slow waving pattern. Now, those that sleepwalk, there tends to be a genetic predisposition. So you will hear that maybe Uncle Bob or Mum or Dad used to sleepwalk as well. And for those where there is a bit of genetics, these are the ones that are more likely to sleepwalk. But there's certain facets about sleepwalking that's very important when I see somebody in my clinic. One of them is called priming factors. Another thing is called trigger factors. Now, priming factors such as sleep deprivation or busy brain hyperarousal or anxiety can prime someone to be prone to be triggered to sleepwalk. So, for example, if you're sleep deprived, then the next night you can have a lot more rebound deep sleep or slow wave sleep, so you're more likely during that time to sleepwalk. Then there are the trigger factors. Now, the trigger factors that we think about is noise, such as the next door neighbours hooting the horn or garbage bins being knocked over. But the other thing that might be a trigger is sleep apnea or snoring, the gasping causing that arousal and causing that sleepwalking episode. And the other thing is, if your partner is rolling over and bumps into that person who sleepwalks, then that physical disturbance can be a trigger as well. When I see people with sleepwalking in my clinic, one of the key features of the history taking is understanding the characteristics of sleepwalking. Now, these are as follows. 1, they tend to occur early part of the night. 2, they tend to just walk around and do very simple tasks, like they might eat, open a tin of biscuits, might say things in a monosyllabic way. You're not going to have a high executive conversation about the laws of relativity with them. They also look confused. They have their eyes open as they wander around. Like I said, you might have a conversation with them. And the other thing is, when they come out of sleepwalking and are awake, they remain slightly confused from then. Now, many of those who sleepwalk do eat, like I said, biscuits. They might put on some toast, get some ice cream. They're not going to do a 5-course Christmas dinner. A lot of them just go back to the room and then back to sleep, and then they're up in the morning. And the other key feature is minimal or lack of recall. So they won't remember that they've been sleepwalking during the night. They'll come to the kitchen and they see all these biscuit crumbs everywhere and bits of toast and melted ice cream, and they'll have no recall of why that happened. One other feature to be aware of, particularly if you're a relative or a partner of someone who sleepwalks, is not to try and wake them out of sleepwalking, because there's a bit of a tendency of them thrashing out back at you, sometimes bumping you in the nose. So if they are sleepwalking, all you should do as a partner or a relative is just guide them back into the bedroom and just leave them there. Don't shake them and say, "Come on, wake up," because you will get that bump on the nose. Now, with regard to treatment, there's a lot of treatment options that one can consider, but primarily it's reassurance. Many people who sleepwalk, it's extremely benign, it's not harmful, it's not a health issue, and so reassurance to understand that this is a physiological condition rather than a psychiatric condition, which is also very reassuring to the sleepwalker. But also just to tell them that, look, eventually they will grow out of it, particularly if they're teenagers or young children, that they will grow out of it, and just to keep an eye on it if you're a parent. However, occasionally some sleepwalkers do put themselves in danger. They might fall down steps, put their hand through a window occasionally, or walk out of the house and across the road. And that's when you sort of think, I think it's time to try and suppress the sleepwalking, and maybe some treatment options would be considered. People have used sleeping medications to try and consolidate the sleep and reduce that arousals in slow wave sleep. But some of them don't really work very well and have side effects. Melatonin doesn't really work that well. Some people have used a benzodiazepine called clonazepam, which tends to consolidate sleep and reduce the muscle tone so they're less jumping around, but the side effects in the morning, particularly foggy headedness and drowsiness. If it is the priming factor of stress, anxiety, hyperarousal, busy brain, and clearly there's an anxiety state with regard to the sleepwalking, one of the things that I found quite useful is something called cannabidiol or CBD oil. CBD oil at night time reduces that busy brain and stress and anxiety. And sometimes what I see in sleep studies is the anxiety causes the slow wave sleep to be quite broken and quite jittery. And the CBD will reduce that jitteriness and also reduce the frequency of the sleepwalking. So CBD oil is something that might be worth considering. Now, going back to Shakespeare, Lady Macbeth, in that description that Shakespeare gives, is a superb example of sleepwalking. Hark, there she speaks, out, damn spot, out, hell is murky. So rather simple things that she's saying.
Out. Damn spot out, I say. Hell is murky.
Well, what's interesting is that William Shakespeare described Lady Macbeth sleepwalking almost to perfection.
Well, this disease is beyond my practice. Yet I have known those which have walked in their sleep who have died holily in their beds.
Wash your hands.
But what was interesting is that William Shakespeare assigned Lord Duncan's death as being the cause of the sleepwalking, the profound grief that Lady Macbeth was suffering from. William Shakespeare describes Lady Macbeth sleepwalking with her eyes open. Now, if you look at what Hollywood did in the movie The Step Brothers, in this example of sleepwalking, where they're walking along the landing, down the stairs, in the kitchen, they've got their eyes closed. So if Hollywood actually read William Shakespeare's Lady Macbeth, they'd actually realise that sleepwalkers have their eyes open. They have to have their eyes open because otherwise we're bumping into things and falling over things. They don't sleepwalk with their eyes closed. So there you go. Hollywood got it wrong. Stick to William Shakespeare. So there you go. That's sleepwalking, and I hope that's been informative and reassuring. But remember, if you're worried about sleepwalking or you're thinking about whether or not you should have medications or treatment for sleepwalking, go and see a sleep specialist. They'll probably organise a sleep test and will then go over those results with you and then have a strategy in place to reduce the sleepwalking. But remember, most people do grow out of it. So hope that's been helpful and reassuring, and we'll see you next time.